Hello, and thanks for tuning in. My name is Jeff McKay from Brightsquid. We're going to go through our next virtual care tutorial, how to assess and treat patients virtually using SecureMail. With me today is Mark Guerra, Director of Customer Operations.
Hello,
Mark,
everybody. Thanks for joining us.
So Mark's been working with clinics for almost 10 years now, I think, Mark, right? Working on different ways to configure SecureMail as we've made changes to the platform and helping clinics get the workflows sorted out and implemented. So we'll be getting a lot of good advice through that in the demonstration shortly. First, I want to take us through a couple of slides just talking about, how we're going to do things, what you can do with SecureMail. So, first of all, you can attach any message. And when we look at the data on what's sent, typically, on average, we have about 2 attachments for every message sent. So attachments is a large part of the reason why people use SecureMail. You can attach any file up to 500 megabytes per attachment and up to as many of those files per message as you need. So you could send a whole bunch of information over to anybody at any one time. And there are no storage limits on your inbox. You don't have to worry about cleaning out stuff. You don't have to worry about taking up too much space. We'll let you have as much storage as you need because that's kind of the whole point of SecureMail. So you can easily forward messages to appropriate staff member or clinician to handle, and that's really what we're going to look at. So this is all about patient messaging you with a new concern that's obviously non-urgent, and doing an assessment and a treatment plan through secure email. And maybe there's some ways that you might want to integrate in-person visits as well, but we'll take a look at that. So firstly, assessing and treating a simple medical condition. So this is done through urinary tract infections, sinus infections, minor skin infections, that sort of thing. And really, it's just the patient can send a quick message, hey, clinic, and Mark will show you how the message actually comes to the clinic and not the clinician. I'm feeling these symptoms, what do I do? And, especially nowadays, you don't necessarily want to bring everybody into the clinic, but you do want to continue to provide that high quality care. So what'll happen, and there's a couple of steps in here, but the front desk will receive the message and forward it on to the clinician for review. Hey, doctor, what do you think about this? And the doctor can, review the concern. The statistics around secure messaging show that it takes a clinician 2.3 minutes on average to respond to a patient concern. So it's much faster than seeing someone in clinic, and there's a lot less work involved around it. And now the doctor might want some further testing. So say, hey, this is my response, this is what I think to the patient. Can you send them this lab rec and have them go around and do this test? So then the patient can go do the test, or maybe just, book the appointment. The clinician will get the results back and review the results and, confirm or adjust their thoughts on the condition. And then, send a treatment plan to the patient. Here's what I need you to do. Here's a prescription I'm going to send. Which pharmacy do you want me to send it to? I can send it over to them through SecureMail, and then put the treatment plan into place. And then, if necessary, follows up. Maybe the clinician wants to send a quick note, or the clinic sends a note a couple of days or a week later. Hey, how are you feeling now? Is everything okay? Or the patient writes back and says, I am still feeling these symptoms. The meds haven't changed anything. Or, I cut out dairy and I'm still feeling these stomach aches or something. And then you can address that way. And if need be, bring them in for an appointment, which is always kind of the case. If need be, you can always bring them in for an appointment. But a lot of conditions, a lot of patient concerns can be addressed in this way. So the other thing that's happening a lot nowadays is home monitoring devices, blood pressure monitors, blood sugar monitors, that sort of thing. And patients can actually forward that data to their clinician through SecureMail, just attach it just as you would any other file. The family physician is going to assess the readings, look at them. Are they normal? Do they fall within the regular parameters that we expect to see from this patient? Yes, then, hey, patient, everything looks great. Thanks for sending that. No need to worry. Or no, hey, looks like this is going on. Let's change things up a little bit to do this instead. And the patient can sort of, similar to the last workflow, follow up with any changes need be, or any questions that come up after that. And again, if appropriate, you can book an appointment around this too. So with that, let's take it to a demonstration. And Mark, if you could just take us through the process of what is a shared inbox, what does it look like, how does it facilitate these kinds of interactions?
Yeah, sure thing, Jeff. I'll turn on my screen broadcast here. And while I'm doing that, when it comes to those home monitoring devices, you mentioned blood pressure monitors are an obvious one, but some of the less obvious ones are things like Fitbits and Apple Watches and things like that that actually, capture quite a bit of information. And there's a lot there that is valuable to the right clinician. Not to mention the most obvious one, which I suppose would be diabetic information. So whether that's insulin reports and things like that, certainly a lot of stuff there that you may not think of obviously, or it may not be obvious at first thought, but there's a lot you can do with that information, especially when it's in the hands of the right clinician. So that's my bridge to broadcasting my screen. So by now, everyone should be able to see what's on my screen. I'm already logged in as an MOA or a staff member in this practice, and I'm viewing the shared inbox. And what I wanted to demonstrate here is the shared inbox being used by a team of individuals. And I'd like to talk about this in these sorts of contexts, especially because I know that some of our practices, when they set up their Brightsquid secure mail account, it may have been, 2 or 3 or 4, or goodness gracious, 9 years ago, and there may not have been much thought given to the team within your organization. And anybody who's heard me talk about Brightsquid Secure Mail in the past will have heard me say the following. Secure Mail is a lot like email. And that's absolutely true. The general interface and user functionality is very similar to traditional old-fashioned email. But where we're different is this shared inbox concept. Well, one of the ways we're different is the shared inbox concept, wherein multiple users within my organization can monitor the shared inbox and respond to patients in a timely fashion as a team. And contrast that with a patient sending a message to a specific person in an organization who has gone on vacation to Mexico, and now that patient's message will not be responded to for a couple of days. So the shared inbox allows us as a team to more accurately or more efficiently take care of incoming patient messages. So in this example here, you can see I've got a message from Adam. He sent in a pre-appointment form for the doctor to review ahead of his appointment coming up on Friday. Now, I don't know specifically what this is. I mean, obviously this is demonstration and sample data, but let's imagine this is a self-assessment form for migraine headaches. And so now we're going to send this file to Dr. Fauchard, and there's a couple different ways that we can do that. We can, of course, forward the message directly. So within Secure Mail, as an MOA within the clinic, I can just click forward, and just like with regular email, I could send the message off to Dr. Fauchard. Or I can download the file and save it into our EMR, and then assign a task to Dr. Fauchard. A couple different ways that we can address those kinds of things. And just looking at one more quick example before I move on to the next step, this message here from Fred, as you can see on the screen, he has requested a copy of a lab requisition form that he appears to have lost. Not uncommon. I myself personally lost a lab requisition form that my doctor gave me last week. So it happens all the time. I assume it's not just me. So in this case, the MOA can go into the EMR, re-download that LabRec form, and simply reply back to Fred with that attached file. He can then print it out and take it to his lab. But getting back to the whole idea of the shared inbox, there's a couple of things that I want to show here. I'm going to quickly switch over to my settings option. So over here on the left-hand side, and within settings, I want to view our clinic members. And I'm logged in right now as Clara. She's the first person listed here as our lead MOA. And you can see that Clara has these two permissions turned on for her profile, in that she's the administrator of the clinic and she has access to the shared inbox. And amongst the 5 people that work within this practice, Clara, James, Pierre, Wayne, and Jimmy, some of them have access to the shared inbox and some of them do not. And it's perhaps quite obvious that the 2 clinicians in this practice, Doctors Crichton Brown and Fauchard, are not, quote, part of the shared inbox team. That work, very rightfully so, is assigned to the staff, Wayne and Jimmy and Clara in this example. So those are the individuals that are managing all those incoming messages um, from patients or from other members that may send information to the practice. Now, in the case of Wayne here, we can see that there's a little orange triangle next to his name. That's just because Wayne's been invited to join Secure Mail, but hasn't fully established his account yet, and that's just fine. He'll sign up shortly and then become a full member of the team. But I want to show you one other thing that's really important in configuring the shared inbox in the most efficient manner. And I'm going to expand our profile for young Jimmy here. And if we look at Jimmy's profile settings, we can see that there's a couple different options here under what kinds of messages can be received to Jimmy's private, or what we call the My Inbox. So for those of you that have been using Secure Mail for a while, you obviously would be aware that you have access to, in some cases, the shared inbox, and everyone else has access to the My Inbox, which is my private inbox that only I have access to. These two checkboxes here under Receive Messages allow me to effectively route messages from specific types of users, patients, or professionals, or both. And if I turn these options off, what ends up happening is anytime someone attempts to send a message to, in this case, Jimmy, that message will instead be routed to the shared inbox. So just take a moment to think about the implications of that. What it effectively does is it turns off Jimmy's private inbox. And let's be fair, Jimmy, as a staff member in a medical clinic, no one is really sending messages to Jimmy Olsen specifically. You know, it's his job to act as a member of the team of the Fauchard Clinic as part of the practice. So it makes far more sense to have Jimmy's name listed as a member of the team, but all messages that are addressed to him should instead be routed to the shared inbox, so that if a message comes in on a Friday afternoon when Jimmy's already out, out to the golf course, that message is going to be received by the other members of the shared inbox team, in this case, Wayne and or Clara. So that's the ideal way to configure your user accounts so that everyone has their own login, everyone is named and listed as part of the team, but Jimmy is not going to be personally responsible for any incoming messages, whether they're sent by patients or other professional users. Everything gets routed to the shared inbox so that the team can handle those messages. Now, one last thing that I'll point out is, and I get asked this question a lot, is can I just create one account for the whole staff to use? And we try to discourage that as much as possible, and I'll show you why. I'm going to go to the directory over here, and we're going to look up our own clinic, in this case, the Fauchard Clinic. And this is how the Fauchard Clinic looks to the other 200,000 Brightsquid Secure Mail users that are out there in the world, be they patients, doctors, lab techs, or what have you. And in this example, we can see the Fauchard Clinic is the name of the practice. Here's the details about the practice, and here are the members. And so this is why it's so important to have all of our users set up with their own individual names, so that, imagine a patient looking for Dr. Pierre Fauchard. He wants to know that he's got the right clinic. Now, Fauchard Clinic Southland is a pretty unique name, but if you're in the dental industry, you know exactly how many dental practices are called Family Dental or Bright Smiles Dental. And it can be difficult for a patient or a provider to be certain that they found the right practice. So if I'm a lab tech and I'm returning a message from Jimmy or Wayne or Clara, I want to make sure that I've got the right person in the right clinic when I address that message to them. So if instead of having all these different individual users in the practice, it just said reception, I might give some pause as to whether or not I've found the right organization. So that's the end of my my talk for today. I'm going to turn the control back over to Jeff, and we'll wrap up with a couple more points and see where it goes. Jeff?
Yeah, thanks, Mark. I'm going to bring back one more slide, and a lot of it, you've already talked about. So just considering the shared inbox, it does allow staff, a team of people to triage patient concerns through the virtual front desk. This is particularly important when you have a clinic that has multiple physicians or clinicians in it, and you want things to come in and go to the right person. This way it functions much like phone, just like when a patient calls your office and they say, I'd like to book an appointment with this doctor, or I have a concern about this. it's handled appropriately through that way. And this is just the same way. We can see the threaded messages. So as messages are forwarded, maybe, a member of the team, a nurse, is going to deal with the patient first. Or, in certain PCNs, there might be a nutritionist or a social worker that might be involved in care too. And that way you have a threaded list of all the messages that have been associated with that episode of care. And in that sense, it does focus expertise where it's most effective. You get the appropriate message to the appropriate person. It reduces scheduling workload because you don't need to schedule time to review emails. I mean, you might schedule time, the clinician might schedule time in their own day to say, this is the time I'm going to look at these messages, but you don't need to align schedules, and that's the important part of it. Asynchronous communication is very popular in every other industry in the world for that reason, because it doesn't involve saying, hey, when can you meet and when can we all get together to discuss this? We can all kind of chip in and say our piece as we have time. This is an evolving situation. Getting virtual care up and running in your clinic is new, and we will be here every week to help you understand what else you can do, more tips and tricks about using SecureMail and implementing virtual care in your practice. You can do a privacy risk assessment in your clinic just to get a sense of where the risks are of privacy breach, because you're going to want to understand that, especially now under the heightened risk. COVID-19 has drawn out a lot more cyber criminals who are being more active, and we want to make sure that you're protected. You can take more in-depth SecureMail training every week, Tuesdays and Thursdays at noon Mountain Time. So you can sign up for that at brightsquid.com. If you look under the SecureMail tab, you'll see the SecureMail training. That'll take you to the page that has all the different options for dates that you can register for training. So go ahead and do that. The clinics that do say that SecureMail is very useful. Once they've taken the training, typically clinics tend to use SecureMail significantly more than they were beforehand, just because they see the value. They get things like the shared inbox configured and some of the other configurations beyond what Mark was talking about as well. So with that, that brings us to our end today. Thank you for tuning in. Let's keep your practice protected. Keep using SecureMail, block ransomware, and increase the efficiency of your clinic. Mark, thanks again for your demonstration. Any final words?
Just one thing to point out. I mean, as you mentioned, there are training sessions available through the brightsquid.com website, but don't forget that our technical support team is available 8 to 5, Monday to Friday, and happy to answer any questions, even do a little ad hoc training session if you need some more help with a particular feature. Thanks very much, everybody. Have a great day.